My name is David Tourgeman. I'm a physician at Huntington Reproductive Center in West Los Angeles and Encino, California. And I'm a board-certified reproductive endocrinologist and infertility specialist. We at HRC do, in fact, do sex selection for family balancing. There really are two alternatives. The first is to sort the sperm via a technique called microsort that is much more effective than just the sperm wash in terms of identifying the gender of interest. Perhaps a much more sophisticated process is actually to evaluate the embryo for gender, and that's done through a process called pre-implantation genetic diagnosis. It indeed is a much more efficient process with a much more accurate rate of the particular gender desired. The caveat is that in order to do PGD, a cell is removed from the embryo at an early stage. This probably has a small impact on the ability of that embryo to implant, but success rates are certainly still strong enough to offer that option to patients for family balancing. We indeed are one of the few clinics that are affiliated with Microsort. We are able to identify the particular gender of interest. And the way that this is done is that a probe is attached to the particular sperm for the chromosome of interest. So if it is a Y-bearing sperm, it is going to attach to the Y, and similarly with the X. For X, it is incredibly efficient, resulting in a female baby approximately 90% of the time. With a boy, or with the Y chromosome, it is not quite as efficient, simply because there's less DNA on the sperm to attach to, and so the efficiency there is somewhere between 75 and 80%. One of the benefits of Microsort over PGD is that indeed no procedure to extract out the eggs is necessary. So this can be done simply by placing the sperm into the uterus, otherwise known as an insemination. Egg freezing has really been around for some time, but is becoming more and more common as there have been very big technologic changes and improvements in the last 5 years. One of those was to deplete the culture medium in which the egg was frozen so that its survival post-freeze and thaw was much more significant. In the past, survival rates of eggs was somewhere in the neighborhood of 10%, so you would have to freeze 10 eggs to get one. That number today is significantly more, somewhere in the neighborhood of 60 to 80% freeze-thaw survivability. The other technological advance was that we found that because the shell of the egg was hardened from the freezing procedure, we would necessarily need to do intracytoplasmic sperm injection, that is literally placing the sperm into the egg and breaking the shell in order to place the genetic material within it at the time of thaw. Finally, there's been multiple changes in the freezing technique that have been used once the eggs are collected. Historically, we had used a process called slow freezing, where the eggs were slowly frozen until they were ultimately placed into liquid nitrogen. Now we use a process called vitrification, which is a very rapid way to freeze the egg and minimize the likelihood of ice crystal formation within the egg. Thus, we are really at the point where we certainly can and do offer egg freezing. However, it should be known that this procedure is still relatively new. there have only been approximately 1,000 deliveries born worldwide from this technology. And as such, we do and can do this very successfully, but do recommend and do advise the patient that this is done under an investigational in an investigational scenario. That is, with institutional review board reviews, and should be considered a study at this juncture.